Hello, everyone. Good evening. This is Judy Reese Morse. I am the president and CEO of the Urban League of Louisiana, and it is my pleasure to welcome you to night 3 of our tele-town hall series. We are so happy to have you with us tonight. We bring this to you in partnership with the Louisiana Legislative Black Caucus, and you will hear from some caucus members throughout the evening. If you had the opportunity to be with us on Monday and last night, Tuesday, you heard some powerful stories, some potent information, and you really had an opportunity to learn more about what we want to share with you, which is about the social determinants of health disparities that are impacting African Americans in Louisiana. And so we're talking about going from disparity to parity. How do we move from disparities to power and equality and equity? That's what we've been talking about throughout this series. And tonight is going to be a great night. We're talking about the influence of income on health. We know that income influences just about everything, but it also can influence our health. And so tonight's speakers are going to help you to understand what that connection is. Again, I want to thank the Louisiana Legislative Black Caucus for their partnership. The Urban League of Louisiana and the LLBC have worked together before. We brought you last year a listen and learn tour that moved across the state of Louisiana. And we also brought you the inaugural policy conference, which was just a tremendous effort. People from across the state coming together to talk about policies that impact the African American community. So this is in line with our work together, and we're so pleased to be able to keep this partnership going. I also want to bring to your attention a document, a strategies document that the Urban League of Louisiana shared with the public last week. It's called Reform, Recover, and Reopen, and it lays out the strategies that we believe must be considered as Louisiana considers reopening the state to the economy. We know that there are a number of issues, and I wish I had time to walk you through each one of those issues tonight, but I would ask that you go to the Urban League of Louisiana's website, urbanleaguela.org, so that you can pull that document down and see all of the issues that we lay out, as well as recommendations about what should be done to address these concerns. Again, that's Reform, Recover, Reopen, and that document lives on the Urban League of Louisiana's website. I want to tell you a little bit about this evening. We are recording this town hall meeting, so you will get a link that will give you the meeting in its entirety after the town hall meeting. We will take your questions. We're going to ask that you use the chat function to enter any questions that you have throughout the evening. Your phones and your video cameras are on mute. So again, if you have a question or a comment, please use the chat function in order to share that with us, and we will get to questions and answers towards the end of our town hall meeting. Thank you for being with us. We are so happy. You could be doing a lot of other things. You have a lot of other choices, but you chose to be with us, and we want you to know how much we appreciate you. I am so pleased to introduce Representative Candace Newell, who is a representative here in the New Orleans, Louisiana area. She is going to bring welcome remarks on behalf of the Louisiana Legislative Black Caucus. Representative Newell?
Yes. Thank you, Ms. Morris. Again, I'm Representative Candace N. Newell, the treasurer for the Louisiana Black Caucus. The Louisiana Legislative Black Caucus, I apologize. And again, I'd like to thank Urban League for putting together this town hall. I'd also like to, in their absence, thank the governor and the mayor for constantly putting the citizens of Louisiana and the citizens of New Orleans first. That's what our main focus is, the people of this state. And as Ms. Morris mentioned, we're discussing wages as it relates to health, and of course, tying it all into how it, the effects of COVID on our communities. By now, most of us know that the underlying health conditions that are most common with the patients who have been diagnosed with COVID are anxiety, obesity, asthma, headaches, Alzheimer's, and high blood pressure. And asthma, obesity, diabetes, and high blood pressure are directly related to stress. When a person does not earn a living wage, there's stress related with that. An author had an article in the New York Times that stated that a higher minimum wage is an antidepressant, a sleep aid, a diet, a stress reliever, and a contraceptive. It prevents premature death, and it shields children from neglect. Poverty can be an unrelenting and shame-inducing and also exhausting condition. When people live check to check, a small setback can be a traumatic and a major event. A few days behind on rent can lead to higher fees that they cannot pay for and can ultimately lead to evictions and homelessness. Unpaid traffic tickets can lead to the loss of a driver's license and the loss of a car, which is maybe your only mode of transportation to your job. A modest wage increase can have a profound impact on a person's well-being and their overall health. It buys medication, it buys rest, it buys food, but it also provides a less tangible feeling of dignity, feeling seen, and being appreciated. Having these feelings has a positive effect on a person's mental and their physical health. And on the flip side, when a person does not make a living wage, their health isn't the number one issue. Rest isn't an option. Healthy foods sometimes aren't an option, and sometimes you can't even afford it. And a person can feel small and insignificant and powerless when they're not making enough money. It feels as though what they're doing doesn't warrant a higher pay, which can also lead to negative effects on their health. Thus, going back to that list of things that I mentioned at first, the stress, the anxiety, the high blood pressure, the obesity, when you just do not have enough money or the time to take care of your health. And to top it all off, most of these jobs that are lower paying jobs do not offer their workers paid leave. So instead of going take care of your health, go and see why you constantly having these headaches. You just tough it out because you have to pay rent. You tough it out because you have to pay insurance. You tough it out because your child's daycare has to be paid. And instead of you having preventative care, it is then emergency care, which you can't afford out of pocket. Most jobs don't offer. And if they do, it's just not enough, which then leads to a whole nother financial burden on these people who are already not making a living wage. And that just constantly goes to the economic disparity that we have in our community. And one of the reasons why I fight so hard with my colleagues in the Louisiana Legislative Black Caucus to allowing and more health care, pushing for a higher wage across the state and paid time off for our workers who we now are seeing are the frontline workers now. We never thought of the stocker at Walmart, the fast food worker at McDonald's as being essential until all of this happened. And these are the very people who need that living wage so that when their health fails, they can go to the mainstream, the person who was always seen as the essential worker, your doctors and your nurses. And that's who we're constantly fighting for. Thank you.
Thank you so much, Representative Newell, for those remarks. Really, really important remarks, and they really create a great frame for the conversation tonight. It is now my pleasure to introduce Tracy Scott. Tracy is the Vice President for Workforce Development with the National Urban League. Tracy is an incredible partner to the Urban League of Louisiana, and there's so much work that we do together, so many opportunities to partner with the National Urban League, and those opportunities are because Tracy Scott advocates for the Urban League of Louisiana. She's a brilliant mind. She's innovative. She's constantly coming up with ideas to share with us. So we are thrilled to have her with us this evening to, again, help us to build the frame for this evening's conversation. Tracy, welcome, and thank you for being with us.
Hi, thank you, Judy. Thank you so very much, everyone, for joining the call. It is my pleasure and it's an honor to be able to address such an esteemed group of leaders for the great state of Louisiana. Honestly, I am humbled by this opportunity. So again, thank you to Judy and her team and the Urban League of Louisiana. So just to, what they say, gesso the paint or gesso the canvas a little bit, the National Urban League is one of the oldest and largest civil rights organizations in the United States. We were established in 1910, and the Urban League movement today consists of 90 affiliates, of which the Urban League of Louisiana is one of our beloved ones. My job tonight is to help to centerpiece the talk of how earnings are an important piece to community stability. And so I'm hoping that I'll be able to convince you to make this a priority for you. So first I wanted to talk about the African Americans and how the African American community has always been in arms linked when it comes to jobs, but also depressed wages has always been a piece of the civil rights movement. So as mentioned, during when the Urban League was founded in 1910, it was founded at a time when the economy was just getting started in the United States. And around the time when President Eugene Kinkle Jones came into play, he saw while there was a booming economy, African Americans were being left out and shut out of jobs that had good pay and had good benefits. And so he saw that there were so he organized boycotts against firms that were not hiring African Americans. He went toe to toe with labor unions that barred African Americans from joining, and then also fought to create pathways for youth to receive vocational training. And now note that that fight still continues to this day, over 100 years later. But good fights can be won. And so in 2013, under the leadership of the son of Louisiana, Mark Morial, and my boss, in 2013, he started the Rebuild America Initiative. And it was a commitment to invest $100 million into jobs and good education. And as a result of that, we've seen in the last 15 years, the Urban League movement has been able to lead 250,000 individuals. That's 250,000 of American citizens now have good paying jobs with benefits. To give you a sense of scale, that is like you walking into the Superdome and telling every single seat that they have a job, and then repeating that act 3.3 million times. That is the impact of when you make an investment and you put focus and you get power behind movement to make truly change in the African American community, home, and in the person, the worker themselves. But note that that success stands on a precipice. A recent study from the McKinsey Company states that 70% of middle-class Black children are likely to fall out of the middle class as they are adults. If we do not pay attention to wage earnings and the depression of wage and wage inequity, all the gains that we have been making will fall back. Here, I'll demonstrate to you in the next slide why that is. The next slide, please. Next slide. So while we're moving on slides, there we are. First one you see here is the percentage of 75.6%. This represents the African American earning power in comparison to white males. This actually represents worse outcomes than it was 20 years ago. In 2000, actually, that rate was at 79.2%. We have slid in the past 20 years, whatever gains we've made, from before them, as a result of earning power among African American workers. The 63% represents African American women and their earning power in comparison to white males. The reason why I take in juxtaposition African American women to white males is because of the percentage of breadwinners or heads of household. In African American women, it represents African American women are 84% of total breadwinners in the African American community itself. Now, and so you can already see that making 40 cents less than white males, it already puts Black families at a disadvantage. And the number one reason, according to a report that came out from Pew Research a few years ago, showed that it's because there's been no policy to specifically address pay imparity or pay inequity among different racial groups in the workplace itself. And that's happened in the past, and nothing has changed in the past 35 years. If you add on top of access or inherited equity, whether it's home ownership, whether it is inheritance, or whether it is through retirement, African American families are being left behind at an exponential rate. Note that education outcomes don't really inoculate against the comparative in earnings either. It has been shown that African American women who have a bachelor's degree actually earn less than white males with a non-bachelor degree. It's not until an African American woman earns a master's degree that she actually earns slightly more than a white male. And that's only by $2,000 more a year more than a white male. Now, that's not also talking about other barriers that bar an individual from earning well or even entering the workforce. So we have a reentry citizens returning who have barriers that ban the box component or practice that is hurting and harming our community, youth that do not have access to entry-level jobs because of a depressed labor and workforce, seniors that have to stay longer in the workforce because they do not have enough to survive in their own savings. And then, of course, we mentioned a little bit earlier in the introduction on housing is a big issue. If you cannot make rent or make mortgage, that becomes a problem. For those who are homeless, many times an individual has to have a job and have earning outcomes to qualify for housing that is available to them. So I want to go to this next slide because I'm almost out of time here. And this would be the slide for a moderator. If you can go to the Black workers earning significantly slide. So when we do get there, a couple more. Thank you, this one. So this is extraordinarily important for listeners to pay attention to. This comes from the Center for American Progress, and it breaks out weekly earning variances for all workers, and it breaks it down by both race and by gender. And you can see here on the far left-hand side that of all workers, whites make $216 a week more than the African-American worker does. If you slide all the way over to the middle to where it says men, that's the greatest variance. That actually amounts to $327 a week that the African-American family is missing out on as opposed to their white counterparts. Now note that actually compounds, the next slide please, to if there's nothing that's being done. This slide comes from the Urban Institute itself. Over a lifetime, the African American household, whether it be male or female, cumulatively the community misses out on $3 million because of this variance when it comes to earning outcomes itself. And note that it's not just at a micro level when we talk about a family and the longevity. It also has a depressed impact on the economy itself. It has been said that the racial inequity in earning outcomes, because African American families cannot invest. African Americans' consumption rate is less than what it could be. It's costing the American economy between $1 and $1.5 trillion between 2019 and 2028. Final slide. So hopefully through my very quick presentation, I've convinced you all that it's not enough for us to create pathways for jobs. It's not enough for us to take a look at how many people have got jobs. We have to, I would implore leadership to really look at how you can find policies, if there's practices, if there are initiatives to really look at and find a way to bridge the wealth gap beyond just jobs, but to begin to address the imparity between the two, because without it, African American communities cannot invest in asset building. And if we cannot do that, then we're looking at the gains of those middle class youth that you have today, that they will end up being back to before where their parents were. And this will become a cycle and a drain on any economy, on any budget. And I just implore you to do that so that we have a stronger community and a more vibrant community, and that we have much better budgets to balance than the ones that we might have now. So thank you for your time. And I cede whatever time I have left, if I haven't gone over, to the next speaker.
Thank you so much, Tracy. You were great on time. And thank you for those very important points. I know the conversation is really going to build from here. We now will have Representative Kyle Green, another member of the Louisiana Legislative Black Caucus, who will make some remarks before we get to our panel discussion. Representative Green.
Thank you, and thank you to the Urban League of Louisiana for hosting this town hall, to Ms. Morse. We at the LLBC, the Louisiana Legislative Black Caucus, we pride ourselves on being the conscience of the legislature. Tracy hit the nail right on the head. Some of the areas that we primarily focus on since we were established in 1977 was focusing on trying to end some of the inequalities as it relates to education, or tackling the economic inequalities that our citizens face, reforming the criminal justice system, and providing access to healthcare. And two of those areas right now we kind of find ourselves dealing with because we've had a history of minorities not having access to economic equality, and how that has related over to the disparities we've seen manifesting itself in the numbers that we see daily with respect to those individuals who are dying or suffering serious illness as a result of the COVID virus. A couple of things I want to put out there, and it was probably stated earlier with regards to wages and salaries. African Americans, account for about 14% of the individuals who are paid at the poverty level. It's 19% for Hispanics. And with regards to pay equity, women as a whole make 67 cents on the dollar that their white male counterparts make, and it's even lower for African American women in Louisiana, making almost 48 cents on the dollar. That has a long-term effect on the communities, on minority communities, because now for the most part, many African American women are the breadwinners of their family, and unfortunately, we haven't had the access to the financial resources to be able to take better care of ourselves. Haven't been able to go to hospital. We don't have access to quality food or nutrition because healthcare is also so expensive. We know we tend to live in food deserts, so the things we do eat aren't the most nutritious. When we look at the COVID crisis, 60% in Louisiana of the deaths are of African Americans. The underlying conditions are the conditions that have plagued our community. 50%, 55% are those individuals who suffer from hypertension, 34% diabetes, 18% cardiac disease, 20% chronic kidney disease, and 18% deals with obesity. So those are the types of things that we've been on the front lines fighting for day in and day out, even before this crisis reared its head. Some of the things that I've been pushing for, and just simply carrying the baton from those who were fighting the fight before me, I introduced two bills actually this session. One that would increase our minimum wage from $7.25 to $9 an hour. The last time we've had a minimum wage increase was in 2007. And it's unconscionable and it's immoral that in today's society, living in the most prosperous country that has this world has ever known, that we still have people who work 40 hours a week and can barely make ends meet to support themselves, let alone their families. The second part is that, like I stated earlier, we have, a pay disparity between men and women, particularly with women of color. And so I introduced House Bill 106, which seeks to eliminate that pay disparity by preventing employers from discriminating wages on the basis of sex. So, I look forward to the dialogue and coming away with some concrete solutions that we can apply here in the Capitol to help make the lives of minorities, but also the lives of all of our citizens better. Thank you.
Thank you so much, Representative Green. We appreciate the hard work that you do at the legislature, along with Representative Newell and Representative Brass, who you'll hear from a little bit later this evening. Well, let's get to our conversation. It's time. I want to introduce you to our moderator for the evening. Her name is Cherie LaCour Duckworth. She's the Vice President for Workforce Development at the Urban League of Louisiana. Cherie? We seem to be having a little bit of a challenge with Cherie's audio, so give us just a second to work on that, and we'll have Cherie with you in just a moment.
So thank you, Judy. Again, I apologize, everyone. I was still on mute. But again, my name is Cherie LaCour Duckworth, and I'm the Vice President of Workforce Development for the Urban League of Louisiana. So in a matter of weeks, COVID-19 has changed the way we work, connect, and live. And so during these unprecedented times, our highest priorities include the health and safety of our employees and our clients, and we will continue to address every matter that touches their well-being. So let's move into this panel. Tonight we have three workforce professionals. The first being Mr. Lamar Gardier. He is the Executive Director of the Data Center. So Lamar, the Data Center has reported on both financial disparities present in Louisiana as well as health-related disparities. Your organization quickly began analyzing this data related to the pandemic and the ways that these two issues impact each other. Please share some of what the Data Center analysis has found related to salaries and wages during this pandemic.
Sure. Thank you, Cherie, for that question, and thank you to the Urban League for the opportunity to present to this panel. If you could jump, please, to slide 3. There you go. There, thanks. So this pandemic is unfolding along two lines. Everybody knows this. There's a health component and an economic component to it. At a high level, on the health side, we see that people of color are being disproportionately affected. We want to look at some of the things that might be causing that. We also see that there's likely disproportionate effect happening for people who are confined to close quarters, who are in group quarters. More data is required to understand that, but we believe that there's a phenomenon happening there. There's also not quite an explanation for the disparities in deaths. Right now, folks talk about comorbidities, but they don't quite explain why there's such a difference in deaths by race. On the economic side, the impact has been widespread, but concentrated in certain sectors of our economy, as you might expect. Many of the workers that are at risk are the ones that are least able to weather an economic shock. Also, as you might expect, New Orleans metro area again faces some of the highest risks associated with this pandemic because of the composition of our economy. Next slide, please. So we should think of COVID-19 in the same way that we think about Katrina. It is a disaster on a similar scale. We do not have to leave our houses. Instead, we're staying in our houses, but the damage is nearly just as great. We can see on the left side here, we have Black Louisianans dying at a much higher rate than white Louisianans. The share of Black people in Louisiana is only 32%, yet we see about 58% of the deaths to COVID-19 going to Black folks. If you see below it, those are the rates of comorbidities that folks are dying with COVID-19. The typical response is that, oh, it's the difference in the rate of comorbidities that's causing more Black people to die than white, but the data simply doesn't bear it out. The difference between comorbidities by race isn't large enough to explain those disparities. There are more Black folks with diabetes, high blood pressure, and obesity than white, but those differences, those gaps are fairly small, not enough in any way to explain the significant gap in the numbers of African Americans who are dying. In fact, heart disease is higher among white Louisianans than Black Louisianans. So we simply have to look elsewhere for reasons why more Black folks might be dying in Louisiana than whites to COVID-19 in terms of proportionality. Also, in terms of economics, again, this is the largest shock that Louisiana has seen since the weeks after Katrina. In fact, it's far surpassed it. And again, as you might imagine, the workers that are most at risk are primarily Black, non-Hispanic. They're renters. They're folks who are earning they're earning below 200% of the poverty level. They're part-time workers. Their median annual wage is about $20,000, and they're less likely to hold degrees. Next slide, please. Next slide. So moving on to health. So COVID-19 has caused significant risk in terms of death to our people. Next slide, please. Right. It has caused far more carnage than the numbers of people who died to the typical causes of death here in New Orleans and in Louisiana. You can see at the bottom, common flu, 43 deaths, accidents, car accidents, 46 deaths. You can jump to accidental drug overdose, 157 deaths, even heart disease, 288 deaths. That's the number of deaths for an entire year, yet in a month and a half, with 416 deaths as of today, COVID-19 has far and away outpaced these common causes of death in just a month and a half. So we see exactly how deadly this virus has been to our population. Next slide, please. So again, here's more data on the racial makeup. 32% of New Orleans is Black, 50 of Louisiana is Black, 58% white. In fact, there are also higher percentages of older white Louisianans than Black. So again, this difference that we see in terms of the death rate for Black and white is simply not explained by the underlying conditions or even by the numbers of folks who are older in the states. The first numbers to come out say 70% of the folks who died were Black. Most recent numbers have said 58% Black and about 1.6% Hispanic. But this is where we see issues with the data. The ethnicity is unknown for 22% of the folks who have died, and so we really don't have a good sense of how many Hispanic folks have died due to COVID-19. Again, these racial gaps remain unexplained, and they simply cannot be attributed to the underlying causes of death. Next slide, please. And one more. So revisiting the economic data here, the week ending April 18th, we saw initial weekly claims of just over 92,000. Again, far exceeds Katrina. This is compared to about 19% of our metro area filing for unemployment insurance claims in the first 3 weeks here. That's a huge amount of folks who are filing for unemployment. The entire state saw about 12% of their workforce file for unemployment. So in our metro area, there's a greater share of people who are losing their jobs as a result of this disaster than across the state. In fact, the New Orleans metro has about 28% of the state's employment base, yet about 39% of the unemployment claims. So again, you can see that disproportionality. This reality may change as time goes on and other parishes start to feel the economic impact. It may balance out, but as of now, the New Orleans area has been significantly more impacted than other areas in terms of the economy. Next slide, please. So we can see in some of the new data that's at the parish level that 3 sectors are having the hardest time as it relates to job losses. That's accommodations and food services, healthcare and social assistance, and retail trade. If you look at percent wise, there are 3 areas that we're having a hard time as well. These are other services. In other services, we have things like dry cleaners, grant makers, pet care services, things like that, personal care services. But then accommodations and then arts, entertainment, and recreation. In these sectors, 30% of the workforce has filed for unemployment so far. Next slide, please. So our economy is seeing significant risk simply because of the nature of our economy. In fact, researchers suggest that 30% of the New Orleans metro workforce is at immediate risk. There are only 3 other metros that have a higher percentage of risk than ours. That's Las Vegas, Orlando, and Oklahoma City. Again, the industries in our region that are faring the worst, our metro specifically that are faring the worst, are food services, retail, arts and recreation, and transportation. Next slide, please. It also appears that just under half of our occupations here possess the characteristics that would increase susceptibility to layoffs. 52% of the workforce is in a low-risk occupation, and that's primarily because they can work from home or are considered essential or are in some other low-risk salary position. A position that might fall in that category might be a teacher or so. So the other 48% are in high-risk occupations. And in general, these occupations that have seen the most extensive risk of job loss tend to be low earners, they tend to be lower paid, and the occupations are less amenable to home-based work. We could jump to the next slide. All right, the characteristics of the workforce here that are at immediate risk, and if you go to the next slide, you can see it a little bit better, are renters, again, people who are earning below 200% of the federal poverty level, people who have not completed a four-year degree, folks who typically don't have full-time work. These folks are at a higher risk. The most vulnerable industries here are also most likely to employ younger workers. Black women also tend to be overrepresented in these more vulnerable industries. So that just gives us a little bit of a sense of the group of folks who are at risk here, both in terms of health, but also in terms of economy. That's it for my question, Sherry.
Okay, thank you, Lamar. That was a lot of data. Thank you so much for that. So my second question is, what do you believe we could or should be doing to shift the way income influences health?
Yeah, so basically all that data boils down to a few simple things. That having low income absolutely makes you more susceptible to disaster. We know that disasters don't in any way improve our economy or jumpstart economies like people think sometimes. They exacerbate existing conditions. So if you were doing well, you may find yourself doing better afterwards. But if you were doing poorly, you're going to have a hard time recovering, and you're probably going to be worse off. Very simply, one of the best ways to avoid disaster when a catastrophe happens is through having wealth. Wealth makes you resilient to disasters. And obviously, the folks who are struggling with a low income are prevented from building the kind of wealth that would make them more resilient. We also heard earlier that having a low income contributes to chronic stress within your life, and we know that the body responds negatively to those conditions around chronic stress. We've never seen a disaster like this one, but it really highlights the importance of paid leave, and typically the jobs that are lower income don't have as ready access to paid leave as some of the other jobs. In fact, many of the factors related to low income are things that we are suggesting are perhaps just as likely, if not more likely, to be behind the gap in racial disparities in terms of COVID-19 deaths. In other words, if you are living in poverty, then you're also in housing that perhaps doesn't afford you the opportunity to social distance within your house. In other words, if someone in your house is diagnosed with COVID-19, you don't quite have an ability to quarantine that individual into a bedroom or a bathroom, preventing other people in the house from contracting the virus. And many folks, New Orleans, who have a lower household income, are also living in multi-generational houses, right? So if you think about these things together, you have a lower income worker who is considered essential now going on the front lines because they have to be out there within the population. They're probably more likely to contract the virus. When they come home, they're living in an intergenerational home. So maybe there are older folks in the home and there isn't enough space in the house such that people who are infected are able to quarantine within the house. And so reason says that more people within that house are at risk of contracting the virus. These households that I'm describing tend to be Black in New Orleans and in the region. And that's certainly a higher risk. Again, not having income doesn't allow you to prepare as well for a coming disaster. You perhaps weren't able to go and stockpile certain resources so that you could avoid going out more often. You're maybe not able to take advantage of food delivery services or other services. You're perhaps having to go out to the grocery more often to pick up food. And every time you do that, you are at a higher risk. This increased exposure that we see due to lower income, which again largely falls on Black households, is one of the things that may be able to describe the difference, explain the difference between the racial gap in deaths, more so than in the underlying conditions piece. So,
Right.
Absolutely.
So thank you again, Lamar. That was an excellent demonstration of data that the data center is collecting and being able to share with us. So next, we want to introduce to you Ms. Stacy Roussel. Stacy is the policy director for the Louisiana Budget Project. Stacy, there are a number of policies related to salaries and wages that also directly impact health. So can you please add to what we've just heard from Lamar by sharing some of the additional context related to income and the policies that are now impacting the disparities of African Americans and what they are experiencing during this pandemic?
Yes, good evening. Thank you so much for the invitation to be a part of this incredibly important discussion. It was important before COVID-19. Now that we are in the midst of a pandemic and facing recovery from that, it's even more important. Louisiana Budget Project is a statewide organization. So I'm going to be presenting some data to you. Some of it very similar to what we've seen already on national as well as local information. We work primarily on state fiscal policy and how it affects low to moderate income Louisianans. And so you're going to see that theme run through what we go over in my presentation. Are we able to bring up that presentation?
So, Stacy, we are working tirelessly in the back end of this. We are having a great deal of technical difficulties. So if you hang on a second, we'll try to get your slides up. But in the meantime, can you kind of, just talk a little bit about the work that you guys are doing at the Louisiana Budget Project?
Certainly. I'll be happy to talk about that. And I'm also happy to start on the presentation. I know that time is of the essence, and I certainly appreciate people taking time out. So what I can do is just go ahead and talk a little bit about the introduction of the data that we'll be able to see in just a few minutes. When we talk about social determinants of health, it's very important to understand that when it comes to health outcomes, healthcare activity only accounts for about 20% of those outcomes. The majority share of health outcomes is actually impacted by social and economic conditions, and that's 40% of health outcomes. And income, family income, and asset base is certainly a big part of that. And so what we want to understand is the structure within Louisiana's economy, and specifically where our workers are from an industry perspective and from a wage perspective, so that we can see what's happening and what it is that's kind of holding them back, holding the state back. So when we have an opportunity to look at it, you'll see some great data coming in from the Louisiana Workforce Commission that's just breaking down the industries that our workers are clustered in. And what you will find is that the 4 industries with just the largest number of jobs, and those are going to be healthcare and social assistance, retail trade, accommodation and food service, and educational services. All of those clusters of jobs, those industries, are providing an average wage that is below the ALICE threshold. The ALICE threshold is a state and region specific measure of what's required to live, a living wage, to be able to provide for your family. So it stands for asset limited, income constrained, employed. And what we want to look at is if we have a mom who is working full-time, is she making enough money to support her family? And what we find is that in these industries where we just have a lot of jobs, we aren't earning enough. The wage is not high enough. So that even if we're asking someone to show up, work full-time, put in, a tremendous amount of effort, we're still not paying them so that they can support their family. And so that's one of the big structural issues that we see in Louisiana.
Right.
Would you like me to continue with the
Yeah,
presentation as in lieu of time? Okay, very good.
yeah, keep going.
The next slide that we would come to is to really understand wage by race when we look at Louisiana specific. And so if I look at 40 years of data and go back to 1979, 1980, you would see that the median hourly wage for a Black worker is $12.42 an hour. That's adjusted for inflation. That's today's dollars. And for a white worker, it's $17. And so we're looking at a gap of about $5 an hour. And that really adds up. And then as we go over time and fast forward to data from last year, we see that the gap didn't shrink, it grew. And so in Louisiana, we now have a $6 gap between Black and white median hourly earnings. And so we need to do something to close that gap, right? And we've heard some excellent policy recommendations, and we'll talk more about that as well. What you would also see is over those 40 years, there are periodic wage spikes for white earners. And we can see that with, big economic kind of booms. And before the Great Recession, we saw some spikes. And we saw that only in the white wage growth, not for Black earners. And so they've lost out on an opportunity to accumulate wealth and build assets. One of the other areas that has been lifted up and is so vital, it's not just wage, it's benefits within these jobs. And so specifically when we talk about paid sick days or paid family leave, what we see, and this was alluded to before, what we see is that those earning the least are 3 to 4 times less likely to be able to take a sick day from work or be able to take a leave when they have a new baby than those earning the most. And that is compounding what we already see as a wage divide. And so when folks don't have that, they go to work sick or they stay home because they have to, and they can lose a job over that. So we need those protections in addition to better wages. Now, you also see we were able to look at paid sick days specifically, thinking about COVID-19, and really break that down by industry as well. And really what we saw was frustrating. It's the largest industry by number of jobs are also some of the least likely to have paid sick days available to their employees. And of course, that coincides with what we talked about as the largest industries also paying below that ALICE threshold, that asset limited, income constrained, and employed threshold of what it takes to support a family in Louisiana. And so the last data point before we really talk about recommendations around this is also just to point out that when it comes to keeping that job and being able to stay employed, when we look at the unemployment rate in Louisiana and we look at it over time, over decades, and we break it out by race, we see that African Americans are facing unemployment at double the rate, and it doesn't change when the unemployment rate goes up and down. That doubling is still there. And so we have got to find a way, again, to close that gap, to close the wage gap. I see my share webcam coming up. Okay.
Right, right. So thank you for that, Stacy. So with all of that in mind, what policy levers do you believe would most impact the health disparities that we're seeing and where wages and income disparities can be addressed so that we do not find ourselves in this situation again?
Fantastic question. And so many of the folks who have joined us already have lifted up a number of these policy recommendations. So they're here for us in bullet point. Folks can go back and really see it as a policy prescription for what it would take in Louisiana. Certainly one of the most powerful things we could do is establish a state minimum wage, and to not only establish it, but peg it to inflation so that we continue to have it go up. And he's absolutely right. We have this session an opportunity to pass a number of bills that will really address some of the data points that we talked about. We looked last year to see what a $9 an hour minimum wage could do in Louisiana, and found that that would impact right over 200,000 workers. It would directly impact over 100,000, and then another almost 100,000 would be right above that $9 an hour, and would be able to bring home more closer to a living wage. And so that is absolutely something that we need to move toward as a state and to pass. We also would like to see an end to preemption so that we can allow Baton Rouge, New Orleans, all of the localities to do what's right for their local economy. And right now we have preemption around minimum wage, and we also have that around sick days and sick leave and paid family leave. So we'd like to see a statewide sick days policy, but also the ability for localities to do what they feel is right for their local population. We also have in Louisiana the earned income tax credit. It's the second lowest in the nation. We are excited that we have it, but we need to increase it. And what's important about an earned income tax credit is that it helps to take our tax structure and make it more progressive. Right now, those who make the least pay the most in taxes as a percentage of their income. It is completely upside down. And so the more that we can use earned income tax credits, child tax credits, in addition to fixing a tax structure, that's very well targeted types of policy solutions. Here we have, a few other very related that will support workers and help to close those gaps. We need mothers and fathers to be able to go to work and know that their children are well cared for, and we need them to do that at an affordable rate. And so that really takes some state support. Louisiana was one of very few states in the South to expand Medicaid, and that has been a tremendous asset and is absolutely vital as we're going through this amount of job loss and going through COVID-19. So protecting that, ensuring that access to Medicaid is a very high priority is absolutely crucial. And then we also, heard about pay equity. That just makes such a difference for women, but especially also women of color. The next slide here are also policy recommendations that I think touch on some of the other topics that you are covering in the series. And so I won't need to go through each one, but I did want to share higher education, absolutely vital. The tax structure, we touched on that. Affordable housing, public education, homegrown entrepreneurs. I know we're going to be talking about that in this series. So there are a number of things we can do, and there are a number of bills that are live this session that we can prioritize.
Right. Great. So thank you again, Stacy. Thank you for the information and the data that you shared as well. And I want to remind everybody that we will be providing the PowerPoint deck after the call. Moving right along, we have with us Ms. Sonia Williams. Sonia is the Assistant Secretary for the Office of Workforce Development at the Louisiana Workforce Commission. So Sonia, we have now heard about data and policies related to salaries and wages as a social determinant of health. Your office has been working tirelessly to respond to the real-time needs that our state is experiencing. Will you please share some of what you're seeing at the state level within the Workforce Commission?
Sure. Thank you so much for having me be a part of the discussion tonight. I greatly appreciate it. We're seeing the impacts COVID-19 is having on our state that was already dealing with some economic challenges. And so employers who were looking for workers trying to improve their workforce are now in a tighter situation because more individuals have been laid off and work production has slowed down and in some instances completely stopped. With more people filing for unemployment and employers not able to sustain their workforce. So we are seeing it from both sides of the house, from the worker side, from the fact that some are making less money receiving UI, they're receiving less money than their paycheck, to those who are making more, who are receiving more than what their average wage was when they were working. So from the worker side or the job seeker side, and then from the employer side, not being able to retain employees to do the work that's needed to keep their business flowing. So we're seeing it from both sides, and so we're working from both sides. How can we bridge that gap so that the workers go back to work, return to work, and the employers are able to employ those individuals and keep production moving forward? So we're seeing temporary jobs, someone who was in a temporary job or a permanent job that are now unemployed, to those who had sporadic work histories, so they were already struggling to find a job and now not having the ability to obtain work, and employers who are not able to fill the gaps that they have in their workforce. So we are also dealing with individuals who may have had barriers prior to COVID that were dealing with multiple barriers. If it was a lack of transportation, a lack of childcare, not having a credential or some type of certificate for them to go to work in certain industries, not being able to apply for certain jobs because they did not have the minimum qualifications. So that is just compounding the situation that we have going on. And employers on the same end looking for individuals who have entry-level experience that they can bring on board, and the risks that's associated with that, the financial risk that's associated with bringing someone on board, because bringing someone on board and indoctrinating them and getting them up to speed in the disciplines that they have for those jobs, that costs money. And so it's multiple things that are hitting both sides of the house. So we're seeing it from both sides, and how do we address that moving forward so that we can get our workforce back on track, so that we have people in a position who can obtain employment, but also those who can retain their employment, and then those, once they are back working, how do they maintain that employment?
Right, right. So in thinking ahead of what things could look like after the pandemic has subsided, you know, Sonia, what do you want to see happen to build back better, to address the income gaps that are impacting African American health and safety?
We are going to need to work in kind of two ways. One is people need to go back to work. And although we may have limitation in their background as far as credentials or their work experience, they may not have an academic background, but may have occupational training, to get those individuals back to work as quickly as possible, reemployment as rapidly as possible. And that can be done by assisting employers with providing some type of subsidy in the form that we have with various work-based learning. I'll explain that in a minute. So short-term training is a good tool to have. But right now we're looking at individuals who need to get back to work, those who are currently laid off or those temporary layoffs that they need to go back to work, and how can they go back to work and still learn while they're working. And so we talk about work-based learning. So opportunities that are available that will allow someone to learn on the job, and at the same time they're earning while they're learning. And so you do that through various tools that are available, such as on-the-job training, where a person is hired in to work with an employer that has a gap, they have a need, and but it's a risk at some point, whether it's a risk to their budget, or it's a risk because they are constantly having high turnover, to where there's the ability to help subsidize that person's employment for a short period of time, so that the employer can help that worker learn what's needed for that job, so that they can become a permanent employer and employee, and not have be an unsubsidized employment. There's also the ability for apprenticeship, to where you are learning the skill at the same time you're working, and you're on a track, and through that track you go through some the training and learning, to where you're earning credentials along the way until someone comes to a point where they become proficient in something, and that helps to increase their earning potential. We have current employees that are working, they're your incumbent workers, and how there are programs available to help the employer train those workers while they're on the job, so that it allows them advancement into the company, which increases work production, which therefore helps with the employer's bottom line. Making sure that the short-term training that's available literally is short-term. Some of the barriers that workers face is, basically, I can't stop working to go to training. I want to continue to work because I have to pay bills and I have to live, but I can't stop and go to training. But I need that. I need to increase my skill, upgrade my skill, so I have opportunity for promotion. And how do you do that? And that's through this earn while you learn process that is available. We are also dealing with some non-traditional jobs, and those normally, we talk about non-traditional jobs for women, jobs that women normally don't go into, and they are many times technical, or they're labor type of jobs in construction and craft industries. We have a population of individuals that have been formerly incarcerated. So when they come out of the institution, finding a job is difficult. And some employers struggle with hiring those individuals. So there are opportunities available to the employer, such as a work opportunity tax credit, or an on-the-job training, so that some of the risk that's associated with hiring someone that's still trying to learn, that burden is lessened. There's also the opportunity for individuals to have supportive services provided as well, so that those who are struggling with transportation or childcare or work-related items, like they can't afford to pay for work boots or uniform, and that becomes a barrier to employment. So how can we help reduce some of those barriers? And we do that through various programs that we have through Louisiana Workforce Commission, that comes under the Workforce Innovation and Opportunity Act, that we serve a population of individuals who are your out-of-school youth. That's a large population of individuals who are not attached to a school system, but they're having a hard time to get into the workforce. And so work-based learning opportunities helps with that. For individuals who have a disability, for those, as I spoke about, formerly incarcerated, for an older worker, someone who was working for a company for 20, 30 years and they were laid off, and now they can't go back to that same occupation, what opportunities are available for them? So eliminating some of those barriers. And it can be a different track. It can be a track that's strictly going right back to work, and there's some that has the academic component that they may need to go back to a 2-year or 4-year institution, or some type of short-term training through a proprietary school. So there are multiple facets to this that we can provide assistance to help individuals to get into a job that is paying higher than minimum wage, and that's a challenge. So when you look at Louisiana's living wage, if you are a single parent with no children and you make $11, a little bit more than $11 an hour, that's still a struggle, but it's considered a living wage. But if you are a single parent with 2, 3, 4 children, then that becomes a problem if you're making the $11 an hour, or even if you're surviving on minimum wage. So having individuals have the opportunity to go directly to work, to have a work-based learning opportunity to where they're able to learn and earn at the same time, or to have them enrolled in a short-term training that allows them to get a credential, to earn a credential that's recognized in industry, that helps them get in the door with more than just a minimum entry point. That is one way to help move that needle with getting individuals higher hiring wage. At the same time, the ability to have benefits. Some folks get a job and they just don't have benefits, so that impacts their health. And it does, it increases stress. And then financial literacy is also a challenge. How do you balance your budget? How do you afford to live within the means that you have until you're able to keep increasing your earning potential?
Great. That is great, Sonia. You know, and all of what you're talking about is certainly not new to us, right? We were doing a lot of these things pre-COVID. And
Correct.
So now we're finding, hello?
Yes.
I'm sorry. Now we're finding ourselves, pivoting, right? And so, Urban League's position is that we won't pause, but we will pivot as we have done. And, adding to some of the things that you talked about, we're working directly with those employers and trying to identify some of the ways of closing some of their gaps and some of their needs, right? And so now we're seeing ourselves having virtual job fairs. I mean, it's not totally new, but in this new normalcy that we have, it is one of those new go-to platforms that we're using. And so we're finding that people are receiving unemployment and they're getting $247 a week, and then they're getting the $600 stimulus. So it's $847. Right. And some of the job seekers are afraid to go back to work, or they rather receive their unemployment while they can, and then they'll deal with going back to work after they think this pandemic is over. And so we've been trying to empower and encourage people to listen, go back to work now, because when we open the state back up in these parishes and these cities, it's going to be a mad dash rush. People are going to be scrambling, looking for jobs. Employers are going to be scrambling, looking for the right job seekers. So, I mean, we have more on our hands that's going to happen later as this pandemic continues to unfold. But we want to move into our question segment now. We have a question for Lamar. One of the questions is, Lamar, will the data center continue to track the data, and how can we push for more disaggregated data about the virus?
Absolutely we will. It's our job to do that in this region. As soon as it looked like COVID-19 was going to be an issue here, we began to look for data that could be used to describe what was happening. Finally, at one point, the state began to put out information. As soon as that happened, we were able to get that information, process it, and get it up on the website. We also took other census data and other economic data that we had access to. And we also worked with some folks at the state level in the workforce commission office to get access to some data on jobs and things like that, so that we could describe what was happening. But at this point, we are at the limit of what we can describe with the data that's being released, the way that it's being released. We absolutely need the states to begin releasing more data on deaths by race. We know that this data is available. This is the same data that's typically available on a death certificate. So we need to make all of that data available here. Specifically, what I mean is death data by race, ethnicity, by age, gender, occupation, parish of death, census tract where the person died, zip code of where the person died. If we're able to get access to data on those levels, then we can do more analysis and get more information to decision makers, so that we can all figure out ways to save lives and to really unpack why more Black people are dying from COVID-19, because it's simply not known and not understood right now with the data that's available.
Got it. Thank you. Thank you, Lamar.
Do in fact maybe to reach out to your state reps and have them advocate for that data to be made available from the state.
Thank you. This next question is for Sonia. Sonia, where can people get help with unemployment insurance?
Yes, hi. They can go to our website, which is laworks.net. They can file for unemployment through the website. Online. There's also a section that is frequently asked questions. I would encourage everyone to go there, look at those questions. It will help you understand the process of how do you apply for your unemployment, what it means, answering questions about, because many people were asking questions about the pandemic unemployment assistance and the federal pandemic unemployment compensation. Many people will say it's $600 that they're looking for. So I would go to the frequently asked questions section so to help people understand, and then they can go in and file for their unemployment. We also have videos to show how to file for unemployment as well as how to file for weekly claims. And they can also call our 866 number, which is located, you can find that on our website as well, to call and to file a claim that way. We are, like many other states, inundated with phone calls for people asking questions. They're just trying to understand, how does this work? And it's been a little overwhelming and put a lot of strain on our system, but we forged through and we are reducing that amount because we're able to get more and more questions answered on our website, and staff members are being able to assist people more and more. So I ask that folks please be patient. We do understand the system can only process so much at a time. The phone lines can only handle so much, but we are responding as quickly as we can and answering those questions to the best of our ability and moving the needle to process the claims that come through.
Got it. Thank you so much, Sonia. Thank you for that. Thank you, panelists. You were great. Thank you for the information that you provided. I feel like I learned something new every day with this pandemic, and certainly I learned about new resources every day, resources that we can provide and share with our constituents here on Ground Zero. And so I want to remind everybody to please wash your hands constantly and to be safe. Judy, if that's the end of the questions, I'm going to turn the floor back over to you. Again, thank you for having the panelists. Thank you, Lamar. Thank you, Stacy. And thank you, Sonia, so much for your wonderful presentation.
Thank you so much, Cherie, and let us all thank you for doing a great job of serving as our moderator this evening. You also do a fantastic job leading the workforce development efforts of the Urban League of Louisiana statewide. So thank you for all that you do every day and for the way that you have pivoted during this pandemic to make sure that the Urban League of Louisiana is able to continue to serve job seekers and our other participants and clients. I want to now turn the program over to Representative Ken Brass, who is the final member of the Louisiana Legislative Black Caucus that you will hear from this evening. Representative Brass.
Good evening, everyone. How's it going? As you mentioned, my name is Ken Brass. I'm the state representative for District 58, which covers the River Parish areas between New Orleans and Baton Rouge. It is definitely an honor, a privilege, and a pleasure for me to serve the great residents of Louisiana. On behalf of our chairman, Senator Harris, and the entire LLBC, I would just like to send out a personal thank you to all the panelists, presenters, and my colleagues that was able to participate on the call on today. Some valuable information, some important discussions were had to where we can move forward as a people to address these issues for our constituents. I'd also like to thank the Urban League for your partnership with the LLBC as far as making a session like this happen. I'd like to commend you on your leadership throughout the state of Louisiana and for all that you're doing as far as making a difference in our communities throughout the state of Louisiana. Secondly, I'd like to also thank the LLBC staff for all that you do. We're putting on events like this, hosting events, being our eyes and ears, and also allowing us to move forward as a group. So I'd just like to personally send out thank you to you guys for the work that you're doing. Before I pass the torch on to the next or last presenter, I'd just like to remind everybody that the legislative session is scheduled to resume on this coming Monday. I'd like to encourage all residents to get involved in the process. I know it may be hard with these stay-at-home orders in effect, but you can definitely reach out to your legislator either by phone, text messaging, Zoom meetings. So whatever you can do, please play your part in the upcoming session. And I do guarantee that the LLBC will form a united front to be a strong voice at the Capitol to address some of the issues that were presented on tonight. So once again, thank you guys for your invitation. I look forward to participating and being with you guys on tomorrow night. Have a good one.
Thank you so much, Representative Brass. Let me thank everyone who has participated in this important conversation. This was really relevant. Again, we are focusing on the social determinants that impact African American health. We're trying to move from disparity to parity. And the way that we will do that is to understand the issues, to be able to keep this dialogue going, to share information with one another, and to advocate, to support the members of our Louisiana Legislative Black Caucus and other legislators, anyone who believes in the issues that we are discussing and that we have been discussing this week. We want to partner with and we want to work with, and we know that there are a number of partners out there across the state. So we look forward to working with all of you. The Urban League of Louisiana will continue to deliver on the policy side, the advocacy side, as well as the programming side. Before we leave, I must remind you to please pay attention to the 2020 census. This is a critical issue for us. We've talked about it at the end of each of the town hall meetings this week. The Urban League of Louisiana has been working to push the census forward since this time last year in 2019. We've been planning, we've been working with the U.S. Census Bureau, we've been working with the National Urban League, we've been working with Fair Counts, which is the organization that Stacey Abrams in Georgia has created. We've been working with over 100 partners to promote participation in the 2020 census. The reason is because federal dollars are tied to the population count. It's done every 10 years, as most of you know, and we cannot miss the opportunity to participate. So we're at home under the stay-at-home mandate that is now through May 15th. We have to pay attention to the census. You can go to the Urban League of Louisiana's website, which is urbanleaguela.org, to get a link to the Census Bureau's website. That will lead you to an online form that you can complete in less than 10 minutes. When we received our form at home, I had a mailer that gave me an ID. I went online, I put the ID in, and in less than 10 minutes on behalf of my household, I was able to complete the form. It's an easy form. It doesn't take long. If you don't have didn't get that mailer and you don't have an ID number, that's okay. You don't need one in order to participate and in order to respond. So please tell everyone that you know to complete the form. If you haven't done it so far, it would be great, a great sign of support if after this town hall meeting ends, which it will in just a few seconds, that you just went to the Urban League website, you used the link to go to the form and you completed it tonight. We've got to do better than we did 10 years ago across the state of Louisiana, and this is the opportunity. The stakes are incredibly high. We now know that, so we've got to participate in the 2020 census. And last but not least, let us get ready for tomorrow night, night 4, the final night of this 4-part town hall series, Urban League of Louisiana, Louisiana Legislative Black Caucus, From Disparity to Parity, examining social determinants impacting African American health. Tomorrow's topic is generational wealth, generational health. We'll be talking about entrepreneurship. We have got a powerhouse lineup of speakers for you tomorrow evening. So please join us 5 p.m. Central. Sign up by going to the Urban League website. You won't want to miss this conversation. It will be full of important information that you will want to have. Learn about the impact of small business success and entrepreneurship and health disparities. So we look forward to having you with us tomorrow. We thank you so much for being with us tonight. We thank all of our incredibly gifted speakers who presented, all the members of the Louisiana Legislative Black Caucus. And on behalf of the Board of Directors and the senior team and staff of the Urban League of Louisiana, we wish you a good evening. We hope to see you tomorrow.